Let's get this party started. So hello, I've had a few name checks today. This is like the most famous I've ever been in my life. So hello, I'm Sarah Blundell. I'm lead for data and analytical development in NHS England, and I lead on this professionalisation workstream. I'm going to hand over to Andy. Who are you?
My name's Andy Lavelle. I am the Senior Analytical Professionalisation Manager at NHSE, working with Sarah. And Hugh will probably tell people I've worked in the NHS for 33 years as a jobbing analyst, most of that in the West Midlands. So it's great to be here. And I'll hand over.
Hi, I'm Elisa Anastasi. I am a data and insight professional lead at the NHS Business Services Authority and one of the Cameo early adopter in the presentation.
Yeah, absolutely. They're doing all the hard work. So this slide might seem familiar because Ming stole it from me. So thank you, Ming. So the vision we have that we're working towards in all of this work stream is to make data and analytics in health and care the most exciting place. So people don't think, I want a career in data, and they go, I want to work for Google or Microsoft. No, they want to work with us because we have the best problems, the most interesting. We have a lot of data when we can access it, and we can make a difference. So why wouldn't you want to work in data and analytics in health and care? And one way we're going to make it the most exciting place to work is by professionalising our workforce. And doing that in collaboration. So it's not just me in a little ivory tower in NHS England. Yes, I know people say that. I was one of those people. It's us collaboratively as a 13,000 strong workforce saying, no, we are valued members of this community. We know what we're talking about, and we deserve to have a seat at that board table that Ming was talking about earlier. And obviously, we're not alone in this. We're the little data family in DDAP, but there are other digital and technology DDAP professionals who are also along on this journey with us. Can I hit the next one? Oh, there we go. So the competency framework. Why did we start with the competency framework? Well, it seemed like a good idea at the time, but also it's this idea of you've got to start somewhere, and the idea of starting with something that then could provide consistent standards that we could then use to influence and infiltrate. No, that's a bit too suspicious, but that sort of idea that then could be a consistent centre that everything else can link off of. So the idea being that we could link then out into what good practice looks like, find those exemplars of areas that are doing fantastic things, link it to the framework, use that as a vehicle to really show a highlight on that, to then also look at, how we would then plan for all these future needs. We keep being told there's not enough data and analytics people in health and care, and we need more of them. Well, great. But who are those people we need? Not just now, not just 5 years, but 10 years, 15 years. It's not going to look like the same type of data role that I did when I started in an acute trust on a band 3 doing winter sit reps. I'm sure people have all done that, and it's not a lovely job, but it's not going to look like that in the future. So what's that succession and future planning we need to think of? How do we use those consistent standards, plot those career paths, sort of pitch our flag to the future, etc., and move there? And then also, how do we consistently work between organisations? If we're all working to different understandings of what a data analyst or a data scientist or a data engineer is doing at different levels, if we want a partnership work and really then be able to identify where those key skills are in areas, and then, like we did in COVID, pivot all those people to really tackle individual projects and areas and topics that are important across organisations, then being able to correctly identify those types of skills and be able to sort of, really streamline that partnership working, this is a starter for 10 on that. And then lastly, obviously, this idea of, that obviously Charlie has already talked about, is how do you create streamlined training? Because we've got some people doing some fantastic, innovative work out in their own centres of excellence, Kent doing their own, in-house graduate style training, in-house Dorset doing their centre of excellence. the strategy unit with all of their, data literacy and decision support training, the Northwest Connect guys who are obviously out there really pushing on that e-learning platforms. We've got lots of fantastic stuff all out there, but loads of people don't know about it. So how do we streamline linking things to the framework and making that type of training known and accessible across the system? Oh no, come on. Here you go. Very similar slide, but we've changed it slightly. So obviously, in this development of this competency framework, it's been going for a while. We did start back in, as Hugh referenced, with that landscape review piece that happened back in the day, that was very much around, that found that there was no uniformly recognised competency framework that was being used, but that there was desire for one to exist. And so therefore that gave us what we felt was the buy-in to then take it to the next stage, to that alpha stage, to basically then look at, oh, it's fallen out of its box. Oh, that's a shame. It looks a bit sad at the bottom there, doesn't it? I know, it's a shame. But yeah, to basically then look at the underlying structure, that modular structure of the framework that Hugh referenced earlier, and developing that. And obviously this, again, our watchwords for this work has been like open, transparent, collaborative. It's not my framework, it's our framework. So this has been then working with working groups that have been drawn from organisations across the country. Andy's going to talk a bit more about in a minute. But basically to then design a framework where 97% of the people then who tested it would support national rollout of it. Moving on then to beta, which is when we've taken that like bare bones framework that's been tested and on-site testing it in organisations around the country, getting them to see how it can be used for recruitment, how it can be used for staff development, and then obviously to expand the framework to include those additional ancillary skills that beta testing identified was needed in order to have something that was well-rounded enough that would cover the whole role of analysts and data engineers and data scientists, both for people going up specialist as well as going up the management track, because there's always going to be people going up the management track. And it was very much found through those surveys, through those interviews, that people found that the framework was required to support that professionalisation agenda. So as I said, we've had support at every stage. And then lastly, our lovely early adopters. Take a bow. Obviously, so this is where we're then testing our implementation approach. Now, we know face-to-face works best through rolling this out. And so we're working with early adopter sites around the country to basically roll out the framework early to test that implementation approach that we'll then take for national, but also to use and abuse them in a lovely way, but to use them to generate the information that other people would need, like example job descriptions, example PDPs, example training plans. Oh, how did you go about, what's the action plan? Who did you have to influence? Who did you have to get involved to implement? Let's make all that stuff, work with those guys, support them, and make that all available so that when we then come to national route in October, all of that stuff is there and no one has to recreate the wheel, unless they really want to. There it is. I'm so
It does. I've no idea how long it took Sarah to do that animation. So just before I go on to this next slide, just to reassure people that know me, no, I'm not going to sing, but maybe later. So what does the framework look like? Now, if anybody's starting to think Trivial Pursuit when they look at that, it is a little bit like that. So you've got your little segments and you're trying to fill in those segments with your skills. So you've got the core competencies of data science, data engineering, and data analyst. And as you say, you can go through the tool. You can start to look at what it means at each of the different levels to do the different competencies that are in there. And it's almost like building your analytical DNA. So you could find you're a 75% data analyst, 15% data scientist, 10% data engineer. But where might that then take you? Where might you want to go? If you said, I'm really enjoying doing data science, how can I get to know more about that? You could start to see the skills and the things that you'd be wanting to do to take you on that journey to become a data scientist. We've also then got, I'll go around that way. So domain's one of the key things that we thought. It's very specific to where you're working. So when the question came in before to Hugh about would it work in public health? Yes, because it's stuff that you want to know within public health that you put in there. It will be different to what you want to know in an acute trust or a community unit or a mental health trust, or if you work in a local authority. There are different aspects to your data flows, the services that are running that you want to build into that domain that contextualizes that information that was spoken about before, because the data's one bit, but what it means to the actual service and the journeys that people are going on through those services is all built into the domain. We've then got the behaviours. What are the behaviours that we want to see within analysts? The equality, diversity, the challenges for learning. All those are listed in there. They've been built up, so you can go through, make sure that you know where you score on those. Leadership and management's come into a category there. This has been developed on a number of other frameworks. We've looked at those and taken them and built the module that will be leadership and management. It starts, so there isn't one for associate practitioner or practitioner. It kicks it in at whatever it was, senior practitioner. I can never remember the levels. So that will then show you the sort of skills and what we're wanting people to do as they move up there. But as a number of people have already said, we don't want it to be that you have to have the leadership and management in order to progress up on things, but it's there as a framework for if you want to kind of look and see the skills that you want. Working in projects. Now, this originally started off as project management, and Donna led this work stream, and it became very clear we didn't want to turn analysts into project managers. We wanted to turn analysts into good project citizens so they understand what's going on in projects and how they can contribute and where they need to be getting involved and how they can maximise their skills within projects that are going on. And finally, specialisms. And as we'll say, this is probably one of the areas that will develop the most. I alluded earlier on to, it looks a bit like a Trivial Pursuit square that's there. Now, if you know, there's probably a new edition of Trivial Pursuit questions that comes out once a year. And it will be the same with specialisms. There will be new technologies. There will be new approaches that will take place. There's already things that people are suggesting and saying you haven't reflected that yet within your specialism area. So at the minute we've got 20, that's your starter. And you can be a beginner, an intermediate and advanced, and it will take you through those skills, and there'll be sort of explanations to what it means at each of those different levels, and experts that will be leading those particular specialism areas to sort of help develop what it means to be in there. But there will be other ones that will come and join. Next one. And this is really about who's been involved in the testing so far and the types of organisations. So we're up and down in the country. Wales seems to have disappeared, but we have got blobs there. We've got the dots there for Wales. But it just shows that the engagement in this has been up the country, lots and lots of different organisations that have been involved, including local authorities, which is really key. You know, the more we're talking, I used to work in population health management before I came here, and I used to just say, there's two aspects to population health. There's a person and what we're doing to that person. All the services that are interacting. So the close links now that we've got with local authorities as integrated intelligence functions starts to take shape across ICBs, being able to talk a common language about the skills that your analytical team have that applies in both local authority and all the different organisations of the NHS is going to be fantastic. Think how that will help you change how you're sort of working with colleagues and identifying what strengths you have as a system, where you really excel, where are the opportunities for you to, you know, develop new skills within there. It's going to be hugely beneficial. So all the different organisations have been involved. And yes, I think it's brilliant, but actually it matters more if people who use it really appreciate it. So I'm going to hand over to Elisa.
Hi, everyone. So we joined our National Competency journey where quite early on in the beta testing phase. So when the opportunity arose, it was a no-brainer, really. Like all the things that you've heard already, it was exactly what we need, and it's really timely. We are a national organisation, and we span the 3 different data professions, and we believe it's really important to empower people to be better at the job that they're doing and to progress to new jobs if that's what they want. And it's harnessing all that data talent and the knowledge around the data and making sure they feel empowered and supported. So once we'd done the beta testing, they couldn't get rid of me. I really wanted to get involved in the ancillary frameworks as well, so joined a few calls there and watch the development of these amazing ancillary frameworks, like the behaviours and the leadership and management, the working in projects that Andy's already described. And then after that, we were also given the opportunity to join the early adopters, which, like Sarah says, we want to give as much as we're getting from this process. So we have been trying to capture our learning so far so that nobody has to do it again. There's no point reinventing the wheel. And this is what's so beautiful about it. It means that I've met so many different colleagues across the health and care space in such a short space of time. So I'm only 13 months into my NHS journey, and it was a pleasure to walk up the stairs and wave to people that I knew already. So as the slide shows, there's the overall mission for the National Competency Framework. There's a vision, but Sarah's skill in identifying in a sentence what we were talking about for a full day was unsurpassed, and we broke it down into 4 goals. And we were 4 people there, 3 heads of service and myself as professional lead representing the data analytics space. And so we decided actually 4 goals and 4 people. This can't go wrong. You don't have to be a data analyst to work that one out. So we've started that journey now, and we have, so we're doing things. Our future involves personalizing the National Competency Framework. It's modular, but it's flexible. You can define a job role down to the sort of very intricate jobs that your individuals are doing. So we've broken that within the data analytics space to exact jobs within our data services, which has been really useful, and we're already using it in our one-to-ones and PDPs. We've sent out our baseline survey, like Charlie mentioned, the all-important, work out where people are to see how much better we're going to get, and revisiting our job descriptions and our job adverts as we go through processes, and make sure that we align with the rest of the NHS as a whole organisation. So I've probably missed lots that I wanted to mention, but thank you for listening.
Thank you for speaking. So what's our plan for national rollout? Everyone's like, we want to get our hands on it. And we're like, we want to give it to you. We absolutely do. Don't worry. We will finish on time. But obviously there's some things we have to get in place before we can onboard everybody. As Hugh mentioned, currently to do the assessment on the competency framework, there's a fantastic Excel tool that I built, which just shows you how long it is since I was a proper analyst. But obviously what we're doing is building an online assessment tool, which is building off the digital learning system that Health Education England did a fantastic job of creating, which is where the nursing competency frameworks are, which is where ours is going. So we're the second area to go on that, which will then link up into all of the Learning Hub on that area and the e-learning for health platform. So the idea is you then have, and we can take things from the example that Charlotte's got, we can then bring that development, all the work that they've done and work that Alyssa's doing, which is identifying training for theirs, as well as the work we're doing with apprenticeship providers to map all the standards, and then have a starter for 10 on where you can then access training and development, link it into things in Analyst X, link it into other things that other areas are doing, to really then have that idea of you've done your assessment, you've done this, you've identified training requirements, go off and do it. Fantastic. So the library of resources, obviously, which would include things like the role profiles, the guidance documents, the action plans from early adopter sites, lots and lots of things in there. But basically the first goal, obviously, is to familiarise. So there's a lot of us going out and talking at people about this, launch events, conferences, etc., as well as through the work that we're doing on social media. Obviously then the plan is to roll it out. So Hugh's obviously mentioned the 2nd of October, that's launch date. We will be doing regional launches. The intention for actual rollout is we will come out to every single ICS in the country face-to-face. And we will ask for organisations to nominate competency framework champions from their organisations, and we will train them in how to use it and how to roll it out. So that will be face-to-face. So Andy and I are going to be very busy this autumn. So if we don't reply to an email, apologies. But basically that's the intention, because we know face-to-face works best. And then very much that moving on to then how we would monitor this over time. We have obviously the workforce survey we do through Analyst X, so competency framework baseline stuff's already in there and we'll be monitoring it through that. But open and transparent, really pushing out the what progress we're making, how many people have we onboarded, how's that adoption going, and keeping it open, transparent, and collaborative.
Thank you. I shall try not to do a Lana Del Rey and get cut off. So this is similar to the last slide that Hugh did. This is just telling you a few more places to go and get stuff. Top one there, if you go to the NHS Transformation Directorate website, you can find everything that you need to know about the framework. We've loaded it all up there, as we keep saying, open and transparent. It's also on Analyst X. Lots of stuff on there if you want to go and look and understand how it was developed and all the background to it. LinkedIn, we've got a National Competency Framework page on LinkedIn. I did have a conversation with Hugh the other day, and I said to Hugh very excitedly, I said, I've got 488 followers on LinkedIn, and I want to get to 500 by the time that we've had the hacker event. And Hugh said, I've got 10,000. Sorry, that was a really bad impression. Right, Hugh's going to kill me after that. Anyway, moving swiftly on, we've got a couple of side room sessions as well. The key bit on this, and if you come to the session at 10 to 2, we're talking about professionalisation and competency frameworks because it's taken us on a journey. So what's it going to feel like when we've got there? What does it feel? What's going to be different when we become a professionalised workforce? Come along and just kind of say what your hopes and ambitions for where this is going to take us, because it's the first step on the journey to get there. And then tomorrow, Sarah will also take you on a walk through the competency framework so you can actually see all the different bits that are there. But it is, if you go to the top one there, the NHS Transformation site is available as an open document source. You can download it and you can start to play with it now.
Fantastic.
Thank you. Did you get to 500? Not yet. Can we get Andy to 500? Is it people have their phones, they're on LinkedIn. Can we please get Andy to 500 followers by the end of this? Well,
probably.
I'll give you a mug or something. Okay, we've got 5 minutes for questions. Do people have questions for our panel? Can we start right at the back, just to give you a bit of exercise? Does someone else down the front have a question as well? Just whilst the microphone's going up.
Sure. So I love the competency framework. I think it's gorgeous, it's detailed, it's accurate, it's fabulous. We're trying to hire an NHS Grampian, come apply, several data engineers, data analysts. I got them graded at band 7. I was like, yes, we're doing it. And it's just not enough money. At the end of the day, we get a trickle of applications. Like if we're asking for cloud server, data engineering, automated pipelines, QA, they're like, oil and gas pays me quadruple. So the thing I'm trying to feed back is that I think we need some prestige attached. That's how we do it in academia. They don't pay you anything, but you get a fancy title and a prize for giving a great talk at a conference. So if we can't pay them, which the salaries are kind of ludicrous, like a senior data engineer, band 5, it's like 28K, right? So how do we put something else in there to say you're doing good, pats on the back? How do we get that other half of the compensation up?
Thank you. Let me just take this question here.
So that's actually the question I didn't realise I wanted to ask. But I was wondering, for the early adopters, did you get a good spread across data analyst, data scientist, and data engineer? Because it would be really interesting to see that.
Thanks. Just let me take this one in and that one there, and then you can have a crack in.
All right. As long as I remember them all. Short-term memory issue.
Hi. Really awesome stuff. I just wanted to ask, from the awesome journey that you've been through, what advice do you have for persons who are wanting to get into this journey but struggle with resource and warm bodies in their teams and department?
Cool. Then just one more question, and then you can have a go. And then you take the mic out to this guy here.
So mine's also a kind of recruitment question, and apologies if you mentioned this and I missed it. I was just wondering, is there any plan to talk to NHS employers about getting some of this stuff onto the national job profiles? Okay. Super, because that's going to really help with the recruitment thing, right?
do recruitment then? Okay, so in a synopsis on recruitment, yeah, you're absolutely right. It's an absolute nightmare trying to get people in. We know that. We're working with the employers to basically put up 3 new role profiles: data analyst, data scientist, data engineer. I'm working with Ruth Levin from the Digital Readiness, and we are literally trying to get this done before the end of July, because we're crazy, at least getting them drafted. So we've actually got some of them with us on our email. So if anyone wants to come and have a look at the drafts so far, come and grab us at CM1 and we'll take you through them. We would like people's feedback on that. As for the finance stuff, do you want to cover that one?
Yep, so as part of the whole DDAT family, we're currently working on how we revise the job descriptions that exist within Agenda for Change. I think it was alluded to, you know, we currently sit within admin and clerical, which has limitations for how we can go. So those discussions are taking place, and we are trying to create new Agenda for Change profiles. The tool that Sarah's done at the moment, when you go through and spec out a job that you want, will drop you into the various categories that exist on an Agenda for Change job profile that you get. I think, you know, on the back of the Hewitt review that came out recently, that once again was adding weight to that call that analysts need to be professionally respected. And just to say before I hand over to Elisa, I'm extremely proud to be an NHS analyst. And, you know, I think it's a wonderful thing to be. And the more people that we can get involved in NHS analysts will be fantastic.
Just another thing to add as well, I found that something like the National Competency Framework means that you can bring people in and offer them that upskilling journey really quickly, and it just is something that they can't necessarily get everywhere else. So on top of the prestige, which I am super proud to be part of that NHS analytics space, it's enabling them to progress fast and using the National Competency Framework. And I wanted to answer as well, so we've got a broad range of scientists, engineers and analysts, and we are really happy to feed back what that journey looks like in the different spaces. We already have people using the framework to cross from one to the other, so that's part of our feedback that we intend to give in the near future about our journey.
Thank you. Can I thank Lisa, Sarah and Andy